The research we are conducting on medicalized FGM, which is a new trend in the way female genital mutilation is being performed, mainly by the healthcare professions, is that this research has enabled us to understand why families are seeking the services of professional healthcare providers in cutting their girls. And secondly, we are also understanding the reasons behind the healthcare professionals accepting to cut the girls. And one of the major reasons is, for example, in our research we have found that the reasons that drove traditional cutting are more or less the same reasons that are driving medicalized cutting. Mainly, the social norms, the religious, people are also cutting their girls because of religious reasons, and harm reduction. For example, there is a belief that if girls are cut by medical professions, then the complications are less. Having understood the magnitude of medicalized FGM, the reasons behind FGM, then we are working with the policymakers through dialogues and stakeholder engagement for us to be able to raise these issues with them. And as we are doing this, we are saying, for example, the numbers are showing us that the efforts that have been put in the abandonment of FGM are being eroded by medicalized FGM. And therefore, there is reasons for us, for policymakers, to work with professional associations, to work with professional regulatory bodies, to be able to come up with the strategies that can be able to curb this emerging issue of medicalized FGM, for us to win the war against abandonment of female genital mutilation in Africa and also in high-income countries, where most of people are migrating from low-income to high-income countries.
Public health policy is sometimes not based on empirical evidence, and a good example of this is the policy on medicalization of FGC of, for example, the World Health Organization, which is actually more based on a moral dilemma, like a moral discussion rather than an evidence-based discussion. And I, with my PhD, I want to provide empirical evidence to support this discussion. So what is female genital cutting? Female genital cutting compromises all practices that give an injury to the female genitalia without a medical reasons. And medicalization of female genital cutting is when this practice is performed by a trained health professional and not anymore by a traditional circumciser. So the dilemma actually is the argumentations for medicalization are that it may function as a harm reduction strategy, and so actually helps the fight towards abandonment as a kind of midway step. And the argumentation contra medicalizations are that it possibly legitimizes and institutionalizes the practice, which still is a harmful practice, so we cannot support that this is institutionalized. So with my PhD, I more specifically look at the association between the social position of a mother and her decision to opt for a medicalized cut for her daughter. And I also look at the influence of social norms to this. I really believe that there is more empirical evidence needed for this, to have this discussion within my PhD, but also outside my PhD, because I really want to move from a moral discussion to an evidence-based discussion.